Okay, folks, so this week we are looking into two chapters, chapter 13 and chapter 14. So chapter 13 is IT alignment and strategic planning. Now, one of the things that basically is very important when it comes to understanding the full utilization of IT, the full benefit to maximize the full potential of IT, you have to make sure that your technologies align to what you're trying to do. So, for example, if you are using technology to increase the frequency of interaction between the patient and the physician. Okay, so there are so many options out there. There's email, there's text-based messaging, there's, you can call, you send regular US mail, you can even use mHealth apps to communicate with the patient. However, having said that, you have to understand that is that technology suitable to the sample of population or sample of patients that you are dealing with or that caregiver is dealing with. I mean, what may be applicable to a group of patients or one technology that may be perceived as very useful to one certain group of patients may not be that useful to another group of patients. So one of the things that you have to understand is that's the basic tenet of IT alignment. Okay, and this chapter talks about, okay, what is the objective of strategic IT planning. Then it talks about the overviews of the strategies, the things that are essential for devising good IT strategy, and this will give you a sense of example of new technology vector, mobile devices. So you have these many mobile devices. In terms of revenue, what do they what do they basically how much revenue do they provide, what are the cost savings, what is the care quality, what's the level of care quality that they provide, what's the level of patient service. So this is a good example to look at. Then you also have IT that can focus on processes or business processes within an organization. So whether it's a hospital, whether it's a clinic, is it making the workflow of a physician or a doctor better, the technology? So if a doctor is using, let's say, text-based messaging to inform patients about their medication, is it improving the physician's work? Is it work efficiency, workflow, etc.? And what are the IT assets? Data, of course, is one of the biggest asset. So the linkage between goals of the organization and the information technology, you can look at this. This is a good example. So say, for example, for capacity and growth management, emergency department tracking, inpatient electronic bed board, ambulatory clinic clinic patient tracking. So that's capacity and growth management. So if you have these technology, it'll allow that organization, that hospital, that clinic to increase their capacity and grow as a care provider. So this is an interesting read in terms of, okay, when we talk about IT alignment and strategy, how do you kind of look at technology and what's your strategy, what's your overall goal, what group are you dealing with, what kind of organization are you, and all these have to be factored in before you want to come up with a foolproof IT strategic plan. Then the next chapter, chapter 14 for this week, strategy considerations. Again, it's kind of a continuation of chapter 13. What are your complementary strategies? What are the main things that you have to consider? How does the strategy evolve? What are the governing concepts? And what is the competitive value of your technology that you're using? How do you differentiate if hospital A uses a certain technology that is also used by hospital B? However, hospital A seems to be getting more meaningful use out of it, or better patient outcomes out of using the technology. What is the competitive advantage for that hospital? Is IT the competitive advantage? And if so, what technology or what way is the technology being used so that it is a competitive advantage? Then there are two articles to be read for this week. One is EHRs and business strategy. So I thought that this would be an interesting read because it talks directly. Okay, you have EHRs, and how do you align that usage of the EHRs to business strategy? Okay, and it's a very short read. Problems with cloud-based EHR solutions. Interesting. Look into it. Now this article is by Porter and Lee. Now Michael Thomas Porter he's a professor, very renowned professor at Harvard Business School, and he writes a lot about strategy, technology strategy specifically. He has an expert in strategy. You must have run into when you in your earlier classes or classes that you're taking, Porter's 5 competitive forces. That's the same Porter that we're talking about. So he talks about Porter and Lee talk about, okay, strategy that'll fix healthcare. Interesting read. Please read this article. Spend some time. It's a 28-page article. That's the reason I only kept 2 articles for this week, because I want you to read this and understand what they're trying to say, and in terms of how you can fix healthcare, how technology can fix healthcare. So just give you a sense of define the scope of service. Organizations that progress rapidly in adopting the value agenda will reap huge benefits even if its regulatory change is slow. So what they're saying is, even if their federal mandates, regulations are slow to come out of, but if organizations can take care of their own business, they will thrive, they will prosper. So last but not the least, they're talking the 6 components of value agenda. So they have these 6 components of value agenda, and please read those 6 components. Distinct but mutually reinforcing. Organizations into IPUs makes people more measurement of outcomes and costs easier. So please read these 6 components and understand what they're trying to say. Again, spend some time reading this article. This is basically, you have a lot of takeaways. You can get a lot of takeaways from this article. With that said, this covers the 2 chapters that you're supposed to read this week and the 2 reading articles for this week. Thank you and good luck.